Hello family. Today let's talk about the role of ultrasound in managing miscarriage. Let's start by defining some few terms. What is a miscarriage? I'll define it as a loss of a pregnancy before 20 weeks. And what are the symptoms of a miscarriage? One, it could be bleeding, it could be lower, it could range to low abdominal pains, the lower back pains. And once you have these symptoms, you'll go to the hospital, and sometimes, most of the time, they'll tell you to do a scan. Why should we do a scan? One of the reasons why we want to do a scan is to look at the cervix, make sure the cervix is closed, or the birth canal. We make sure the birth canal is closed, is long and closed, so that you want to rule out something called cervical incompetence. If it's short, we are able to advise you, or we are able to inform the clinical team that is attending to you, so that something can be done to make sure that we can carry this pregnancy to term. We also want to look at the cervix, at the birth canal, just to make sure there's no masses, there's no cyst around the cervix. We want to look at the uterus, make sure there are no masses, there's no fibroids around the uterus. We want also to look at the fetus, make sure that it's implanting well. We want to rule out something called subchorionic hemorrhage, where there's detachment of the fetus at the point where the fetus is implanting or is attaching to the wall of the uterus. We also want to look at the ovaries, just to make sure that there's no cyst, there's no disease, there's no pathology around the ovaries. We also want to look at the region around the uterus, just to make sure that there's no infection. We'll also want to look at the placenta, make sure the placenta is forming well and is not forming down there. It's not forming down there to cause a condition we call a low-lying placenta in the medical field. So these are some of the things that we look at, just to make sure that if you are bleeding or if you're having issues or pain, is not because of a miscarriage. But once we do a scan and we find out that some of these issues can be detected, then there's a solution, because your team, the clinical team, will be able to offer a solution to this, and you'll be able to carry your pregnancy to term. So once you have all these issues, kindly, when you are told to do a scan, please don't fear. As I've said always, a scan is a simple procedure, it's a painless procedure. Don't fear, because once we do the scan, we are able to look at all these things, and just at least ascertain or know the cause why you are having either threatened miscarriage, or why you are having bleeding, why you are having pain in pregnancy. So kindly share the information outside there. These are some of the things, so that when you go into the ultrasound room after you have been sent for this examination, some of these questions are supposed to be answered. Again, it's true that bleeding might not be because there's no abnormality. It could just be, maybe it could be implantation bleed, but it's always good to do this thing, so that at least we know if there's a problem, how we can handle it. So thank you. Yeah, it's always good speaking to you, and actually we looking forward just to speak to you again. Thank you very much.